Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right, welcome everyone back to another episode. Today I'm with Dr. Tom Stone. He is an oral and maxillofacial surgeon practicing in Denver. Tom, thank you so much for joining us again on the podcast.
Thanks, Grant. Always great to be with you.
Yes, loved our last episode about the emergency implant and kind of your thoughts and experience with immediate implants and how to find success with that. I got a lot of great feedback, so what a great topic. Thank you for sharing with us.
Absolutely.
Today, we wanted to talk a little bit kind of about this educational platform, drtalk. We've talked a little bit about that online platform before, but could you explain just a little bit to our listeners about kind of the learning hub aspect of drtalk and how that can be an educational powerhouse?
Yeah. Thanks for the nice intro there. I think we all see dental education. The dental education market is moving towards digital native, and it's moving pretty fast. The practitioners that are your age, practitioners who are 30 to 45 today, they don't learn the same way that my generation or previous generations have learned. And what we see is that they want to learn on mobile. They want to learn from their peers. They want to have, real-time interaction, meaningful interaction. Everybody's busy, and so being able to learn asynchronously is an advantage. But I think the most important thing that I've observed is that clinicians today expect learning experiences that look just like the consumer apps that they use every day. And this is where drtalk, I believe, is transforming education, meeting our younger colleagues, if you will, where they live, where they shop, where they travel, and now where they communicate and learn. And I think your listeners are probably saying, well, why do I even need to do education? Why is it important for a specialist to provide education? I believe that the best ways to grow your practice are to communicate with your colleagues and educate your colleagues. And I think over the years, as we've helped our colleagues improve and help them become more productive and help them become better clinicians, it makes all of us better together. A good example of that is just the implant revenue cycle. I don't know if you've ever seen this, but it has the restorative dentist at the top of the cycle. And we know that, clinicians, whether dentists or oral surgeons or physicians, typically recommend what they know. And we don't get a lot of treatment planning experience in dental school. We get a little bit in residency, but dentists tend to recommend what they know. And so if they learn how to treatment plan, they will either place or refer more implants. And then we've got to have a good system to be able to capture those implants. The drtalk AI-powered intelligent referral management system does this really well. And so if you capture more implants, you'll place more implants. So it's kind of makes a lot of sense. And then you realize, hey, educating the general dentist drives growth in my practice. I want to provide more education. I want to make it seamless. I want to make it inexpensive. And I think it's important to give them learning on the go so that they can access that content whenever they want. And so this model really scales dental education to your restorative colleagues. We started our mini residency, our mini residency study club in 2002 in Denver. And at the time, there were two study clubs. Our study club, which was more of a mini residency and treatment planning program. And then there was the DISC program, which is the Dental Implant Study Club, which Dr. Aldo Leopardi sponsored. And he's done a great job with that over the years as well. But that's grown, and today there's over 300 study clubs in the greater Denver area. So you kind of have to kind of figure out what makes you stand out from everyone else. Are you just going to be a regular study club and hire somebody and they get up and they just talk about their very best cases? Or do you provide case-based learning and treatment planning, which I think helps make your education program stand out from others. So that's a little bit of history. I'll finish with this thought. Right around 2015, we noticed in our practice that attendance at in-person education events was trending downwards. And I think after COVID, it got really bad. And I've watched a lot of people try to solve that problem. People are building websites, static learning models, webinars, and videos. And we kind of spent a few years and kind of some significant capital figuring out, what is it that actually works with education? And we learned that, engagement patterns matter, the content matters. I think the speaker or the channel host matters, the features, the user experience, but most importantly, what makes the dentist or what makes your colleagues engage and actually come back to that learning experience. And so I think that's where Dr. Talk is kind of setting itself apart.
Yeah, and that kind of leads into the next question, because it seems like you said, COVID really changed things to much more of an online learning, and that was more of the expectation. And it was kind of like, well, now we see that we can learn so much from our phones, from home, from computers, and it kind of changed the mindset. And then it probably became a more of a burden to actually have to go to a conference center or someone else's office and sit there and watch a PowerPoint. And so I could see that being a turnoff for a lot of practitioners. And then I noticed the switch and a lot of learning happening in sites, even Instagram, Facebook. I mean, there's Dental Town, there's these groups that tons of information, even patient information being shared like on Facebook setting, and hundreds of people commenting and people learning, but it's in a gray area of like how legit is this information, and should this be shared in a setting like this? What is the difference that Dr. Talk, the platform, has compared to Facebook and Instagram and some of these other places?
Well, I think you nailed it, and that is, security and sharing, patient healthcare information on, improvised communication platforms that are actually not HIPAA compliant. Some of them might say they're secure, but HIPAA compliance is known sender, known recipient, business associate agreement, encryption in transit and at rest. There's a lot of boxes you have to check to really claim that you are a HIPAA compliant system, and Dr. Talk is that. But I think the most important thing is it's a mobile first education delivery system. So the ease of use, the convenience, and then I think security is also important. We have a ID verification system, so it's kind of like going through TSA. You show a facial biometric and a government ID, and then you're into the platform. And then that everybody in that platform has signed a business associate agreement and is under the same, kind of rules as everybody else. So I think that makes it different. I think being able to access high value content, on the go. And when you're watching a video or you're watching a static learning module, you really don't have the opportunity to ask the industry speaker or the industry leader or the speaker any questions. And Dr. Talk gives you a real-time experience where you can actually go right to the source and ask them. And we found that some people are a little shy. I mean, you get into a virtual classroom with hundreds of people, and I don't know about you, but when I was in dental school, I didn't really like to raise my hand in front of everybody because I was always nervous. Well, is this a dumb question, or is somebody gonna make fun of me? The cool feature in Doctor Talk is now you can actually submit a question in anonymous mode. And we've noticed just an uptick in engagement with people wanting to ask questions and learn, but maybe they were a little hesitant to ask the question, and now they can do it in anonymous mode, and just makes it a little bit more comfortable for them. So anyway, I think those are the
Yeah.
main things that set it apart.
That's awesome. Yeah. I totally in the same way, usually there's one or two people who dominate the questions in a large group, but most are probably pretty hesitant to speak up and say what they're saying. So that's
Yeah,
a cool feature.
yeah, we're all like that. I mean, I think that's just human nature, and uh, I think we all should be a little bit more confident, but I'm I'm not that confident in large groups, and so it just gives people an opportunity to participate, but not feel so exposed.
Yeah. And you mentioned Dr. Talk in this kind of relationship from the specialist to the referring doctors and trying to drive engagement and collaboration. How have you seen that happen on this platform?
Well, I think one of the reasons why we started building Doctor Talk is after years of just observing dentistry being so siloed. We all work in four walls. We don't have an opportunity to collaborate, outside of our, organizational boundaries. And so I think what Doctor Talk does is it builds a secure digital community around your practice for not just exchanging, patient healthcare information, but offering seamless communication where it's just click, drag, drop. Um, Point of care scheduling is a great feature with Doctor Talk, and really, like, I just, voicemail and phone tag drives me crazy, and so the ability to be able to reach my colleagues on a secure platform and get real-time answers in a reasonable amount of time, I think that, is really what, drives engagement and collaboration. I think I'd mentioned earlier, I think the two biggest, you know, practice builders, education and communication. And, you know, beyond communication, there's like a lot of people kind of try to figure out, how do I grow my practice with education? And I see a lot of people doing tech nights, which is great. I think tech nights are a great social event, and an opportunity to share maybe some new technology, but it's not enduring. It's not a long lasting growth plan. I think, practices will see a small bump in productivity, perhaps for a week or two, and then the whole effect just kind of fizzles. And so, what we've tried to create is a digital or even a hybrid continuum where you have a speaker or an industry leader that is continuing to mentor and provide guidance in treatment planning. And like I mentioned earlier, when you make the dental community better around you by teaching them how to treatment plan, that really drives meaningful, long-lasting growth. And I think the real winner with that is the patient. The patients have better, treatment options that are given to them as a result of this whole educational process. I think another example of efficiency is we have a chat thread. It's a secure chat thread with 183 of our colleagues on that chat thread. And I think about a lot of practices. When I was trying to build my practice, we'd go do a lunch and learn, or I'd do a doctor lunch. And you think about how many years would it take you to do a lunch and learn with 183 dentists and their teams. And yet now we can post one message and we can reach all of our referring doctors. We can share the results that maybe one doctor has gotten with a full arch case, or maybe an anterior aesthetic case. We give announcements for our practice. We talk about events, educational events, share interesting cases or clinical findings, and it just drives a lot of efficiency and the ability for us to engage a high volume of colleagues with, just one text message or just sharing one case. So that's kind of how it helps us with efficiency and collaboration.
Nice. And for practices that would want to host like a virtual study club, how would they go about doing that? Because I assume they would have to make sure whoever they want to be in the study club's got to sign up. What's that process look like?
So we do it through a channels-based architecture. And when you start a channel on the Dr. Talk platform, you can make the channel public where thousands of colleagues can see that channel, or you can make it private. And in our case, when we run our study club, we make it private. So we have 148 of our colleagues in our private classroom where we share patient informations and treatment planning techniques. So then the second question is, do you want it to be paid or free? We make ours free. We don't charge our colleagues to participate in our education event, but you certainly can have it be paid access if you want. And there's some practices that do that. And then you can decide, do we want to provide continuing education or not? So you build a channel and then you can customize it to your practice. And there's some surgeons and clinicians and specialists that actually make themselves the host of that education channel, and they push the content to their restorative colleagues. We typically put a speaker or an industry leader on a retainer, a monthly retainer, and then that speaker is, publishes a curriculum. And so there's like learning objectives each month. And then at the end of the month, the clinicians can take a quiz or do a personal attestation or a hyperlink to a CE module where they are able to receive their continuing education. And then that's just emailed back to them. So that's kind of how we do it. The Dr. Talk team has really made this effortless to a point where you can invite colleagues from your mobile device to join your study club. There's a suggestion engine. So, when you're on the app, you get, people within a 50 or 60-mile radius of you that are also on Dr. Talk. You just click and connect with them. And I think the nice thing is it's free for our restorative colleagues. If you go to a meeting and you decide to have a meeting or a webinar and do a hybrid education program, there's a link or a QR code that everybody in the room can click and then capture, and then they drop into the virtual study club. So these like there's dozens of virtual study clubs right now that are being run across the country that are driving increased engagement. And I think especially with DSOs, this is appealing because they can run education programs, they can engage literally hundreds of restorative colleagues and specialists in one classroom without the high costs of travel and venue and catering. And so it enables them to scale their education programs uh, and use digital scale. So that's I think that's exciting, and it's pretty easy to set up. Our Dr. Talk team is awesome. They really provide white glove service. So if people want to do that, they really don't have to do much work.
Nice. What type of feedback have you got from users on its impact um, on engagement and efficiency in their practices?
Well, I think, like I said earlier, content matters and frequency matters and the speaker matters. If you start out with a curriculum and then you don't engage with the people in the classroom, if you don't answer their questions or you let things linger for a week or two or a month, then engagement does tend to drop off. So we find that content, the speaker matters, the frequency matters. At the end of the day, Dr. Talk is just a delivery system. And so if you can put together a really just interesting curriculum, I think that drives better engagement. And so that's kind of the feedback that we've received.
Are there any examples you could share of how practices use Dr. Talk to kind of streamline referral management and get enhanced participation through a study club?
Well, I think there's actually a couple of examples. So, about a year and a half ago, I went to Budapest, Hungary. A lot of your listeners on this podcast have heard of Dr. Istvan Urban, just like an incredible course in Hungary. And I went with one of my partners, Dr. Arsenault, and literally probably one of the best CE events I've ever been to. I mean, first of all,
Wow.
Dr. Urban's just a great host, and the content was just over the top. It really changed the way I practice oral surgery. It gives me so many more solutions that I can offer patients and restorative colleagues um, as we treatment plan together. But as we were there, there were a lot of students who were like, "Hey, if I have questions, what do we do?" And Dr. Urban said, "Well, if people have questions, usually they email me." And he said, "But that's not really good because Hungary has a HIPAA law." And he said, "I just don't want my inbox flooded with patient pictures and information." And then he said, "Or they come back." I was thinking about the thousands of dollars that I spent to get over there and stay there for the course, and then the tuition, and to
Yeah.
have to do that again just to get additional mentoring seemed a little bit over the top. Well, there were about 20 of us in the course that jumped into a chat thread on Doctor Talk, and we had clinicians from all over the world. I mean, from Europe and South America, and some from Japan. And we all were in this chat room together. And we were, for about a year, we shared cases, things that went right, but also things that went wrong. And it was just this great collaboration that continued on even after the course. So I think that's one of the ways that it's effective with teaching is just pre and post course. There's a niche education group in the Northeast that has partnered with Dr. Talk. They just completed their fall cohort, and they had people from Australia and Germany and South Korea and South America pre-training, where they were actually sharing cases ahead of the in-person event. And then they've continued to have mentorship after the course. And so just being able to access the provider and having ongoing mentorship, I think, is something that's been missing in dental education. So,
Oh, for sure. What is the um like the knowledge for those who want to share content and potentially host a channel, things like that? What does the knowledge monetization feature look like on Dr. Talk?
well, that's a great question. I used to speak for an implant company for about 15 years, actually for about 20 years, and I would get on a plane Friday night. I would travel sometimes to Florida or across the country, get in really late. I'd speak all day on Friday, and then I would sometimes my flight would be canceled on Friday night. I'd have to stay over again, and Saturday I'd come back. So it's a lot of time out of clinic. And then my email account would just be flooded with questions, and my cell phone for that matter, from participants at the course. And I always loved to um, help my colleagues, and I did that, at uh, no additional cost. But I think increasingly, industry leaders and um, speakers like to have the option of providing, knowledge virtually. And so they can, earlier in your podcast, I said when you set up your channel, you can make it public or you can make it private. You can make it paid access or free. And so we have some, very intelligent and well sought after industry leaders that have set up a channel which is paid access, and there's like a monthly subscription, but it gives clinicians direct access to those industry leaders. And so you actually get, you know, mentorship on demand. And, what we've learned in dental education is that as dentists, we are willing to pay for knowledge, and especially if it can be done in real time, in a timely manner that gives us answers to clinical questions that we can then go back on Monday morning or the next day and implement in our practice. So Dr. Talk has set up a Stripe payment system where clinicians can monetize their knowledge as they should. They're giving their personal time and mentorship away to other colleagues. And I think in dentistry, we value that. And so we're willing to pay for it. So that's a little bit about the monetization feature.
Yeah, that helps a lot. I mean, you've mentioned that it's a pretty simple process to get started, and you have great staff, you know, on that. I've had a good experience too signing up. Any other thoughts or comments on how a practice can get started on the platform?
Yeah, I mean, I think so. Um, for the referral management part of the system, what the feedback that we get is it's super easy to use, and the reason is because your restorative colleagues don't need to do anything different than they're already doing. They don't need passwords, they don't need to download an app. They certainly can do that, and I think that makes their operational efficiency even better. But they don't have to do that, and so it makes it really easy to use for the specialist. I think you know it ensures that you don't miss any referrals. I mean, you have an ironclad system where all of your referrals, no matter what pathway they're coming into your practice, land in one dashboard. And we've talked about that before, and they get realized immediately. From the education standpoint, I think the ability to communicate directly with industry leaders for mentorship and learning on the go. I find that dentists don't mind going through a little bit of an onboarding process to be able to have that ability. And again, the Dr. Talk success team is fantastic. They'll give white glove service, and so it's very easy to onboard and connect with colleagues and utilize whatever features you want on the app.
Nice. Yeah, that sounds like a pretty smooth process. If you're good with that, we'll put links, to Dr. Talk and the platform and your contact info, mine as well, in case people want to reach out. But yeah,
That'd be great.
this has been a great episode. I think this is a fantastic tool that has taken a lot of work from you and your team members to set up, and what a great space to be able to share patient information and also just educate each other. I mean, it's awesome.
Well, thanks, Grant. I think the thing that's really great is that this is a product that's built by dentists for dentists. And we see a lot of products that are developed by tech people, and they don't really solve our pain points. But as dentists, we know what those daily pain points are. And so when we can make life easier for ourselves and for our colleagues, that's a win for everybody. So I just appreciate the opportunity to talk a little bit more about it. We're obviously passionate about it, and we've spent a lot of time just trying to understand what really is going to reduce the chaos and friction in a dental office. And, some of the feedback that we get from our dental colleagues is, I feel like I got my life back. Like I don't have to spend all those extra hours tracking down referrals or tracking down emails or text messages from my colleagues. They all come into one place, and we're able to just provide better care to our patients as a result. So
Oh, so awesome. Well, thank you for sharing and taking the time today to talk to us about this. You're always a good sport with sharing content and helping us learn new things here on the podcast. So appreciate it.
always a pleasure, Grant. And I will say I'm planning to attend your course at the Collective Health Society next month. I'm really looking forward to that. You're going to be talking about, I think, PRF and Exparel. Is that right?
Yeah. I've been doing that for a couple of years now and had good results, and seems like a lot of people are interested in learning more. So I thought it'd be good to do. I mean, it's only a couple couple hours, but it would be a fun thing. And who knows, maybe we could also put some of that content on Dr. Talk and provide an online forum for those who couldn't make it in person.
We could call it the Grant Stucki channel,
Perfect.
All right. Well, I look forward to seeing you next month, and thanks again.
No problem. Have a good rest of your day. Thanks, Tom.
All right, Grant. We'll see you.
Bye. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.